Lung damage, less than 10% of patients, much worse than smokers. So teenagers who smoke, who had LCH as children, it's one of the things I keep saying to them. Drink if you want to, but try not to smoke. And if you do drink, as I said earlier, make sure you take all your medication. But all the ones where they've had abnormal lung problems, they've all been smokers. The amazing thing is, if you have lung involvement as a baby or under the age of 5, you seem to repair your lungs and they get better. If you have it as an older child or an adult, your lung just doesn't seem to completely repair itself. They get breathless on exertion. You can give them steroids. Some of the adult pulmonologists will use other medication, but they're really, really severe. We've got a couple of patients who've had to have a lung transplant because it's been so bad. Everyone's been talking about brain problems. It's rare, but it can be serious. It is late onset. And here we're talking about really, really late, sometimes up to 10, 15 years, which is why you need to follow up patients long term. It's not a question of your LCH is gone, you look great, I'll discharge you. They need to be followed up long time to see what's happening. One of the patients I had, he was treated in a different hospital, came back just for the long-term follow-up study. And he couldn't walk straight. He had the IQ of a 6-year-old. He was 20. And the problem was, Mum, I said, didn't anyone realize? And Mum said, well, I thought that's the way he is. That's just him. And it was such a shame because everyone had been seeing him every year in the hospital and saying, great, your LCH hasn't come back. And this child's brain was a mess and they hadn't picked it up. Not that we could have done anything about it to cure it, but we could have helped him. So this, you've seen this MRI from a different side. You've seen a cut that way originally. This is the other way, and this is the bit of the brain that gets involved. It's the cerebellum. If you look at it initially, if you go back and look at the old scans the patients had, they're often normal. There's nothing there. If you go back and biopsy them here, there's just scarring. There's no LCH there. So when it happens and what happens, we don't know for sure yet. We don't know whether it's directly LCH involvement or a side effect of something that LCH does to the chemicals in the brain at the time. Patients often present with poor coordination, so handwriting goes off, schoolwork performance goes off. They get clumsy, they fall over themselves. One of the things with older children I've found out is that they hate having a shower. And the reason for that is you put on the shower, you close your eyes, and you fall over because you lose your balance. Because children with cerebellar problems use their eyes to maintain balance. As soon as you close your eyes, you fall over. So they go from having a shower to wanting to have a bath, or not having a shower on their face. And it's very subtle, but it's one of the things you learn. They get funny eye movements, problems with their speech, and unsteadiness. This is what you were asking me about, the neurocognitive study. I just did a study on 40 children who'd had multisystem LCH, came back for a follow-up, and it was just, the more we saw, the more we felt, well, this one's got a learning problem, that one's got a learning problem. He's in special school, someone else is in a special college where they're being taught skills to look after themselves, from brushing their teeth to cooking to learning to live independently, handling money, being able to go out to the shops. And there were a lot of them. There were about 7 or 8 out of 40 were in special schools of some sort at different ages. Which is why we then did the IQ testing on all of them. And if you just had LCH in other organs, you were fine. I know that a lot of people talk about diabetes insipidus as being CNS, and I, as an endocrine person, have a basic problem with that. I don't think it's a CNS organ. I think it's outside the brain. And if you just had diabetes insipidus, actually, your IQ is fine. But if you had anything on your MRI scan, even if you didn't have any symptoms, or if you were unsteady on your feet, or you just had behavioral problems, and you went back and looked at their IQ, and that was a problem. They also had problems with memory, and it was short-term memory and long-term memory. And if you imagine how you learn, you told something, if you can't remember it 10 minutes later, that's it, you're not going to learn. So this is one of the reasons why these children don't learn at school. So although you can't do anything about the CNS disease, you can't treat it, what you can do is adapt your teaching mechanisms. You repeat, you reinforce, you make sure that you use methods in teaching that help them learn. And that's why it's important. We tried to develop a morbidity score, which we have developed one, we just need to validate it. And we're looking at whether the doctor's assessment of how bad a long-term problem is the same as the patient's assessment of it. So this is a completely medical way of looking at things, because doctors have a different perspective to life. We're looking at, can you walk straight, can you do this, is your LCH still there? And so we looked at movement abnormalities, learning, IQ, lung dysfunction, cosmetic problems, that was me putting it in, endocrine problems, and hearing loss. And we graded it as no problems, very mild, didn't need any treatment, moderate, which were there, but you could correct it. So a hormone problem that you could give them growth hormone for, or diabetes insipidus, or hearing loss that was corrected with a hearing aid. That was moderate. And the severe ones are ones that you can't correct completely. So if you have bilateral severe hearing loss, hearing aids don't necessarily correct it. If you had panhypopituitarism, all your pituitary hormones were knocked off, you replace it, but you can't adjust them the way the body does. Your body adjusts the levels of hormones depending on what it needs. And you can't do that with medication. And that's always going to be a problem. And what we needed to think about is, how do you weight them? Is severe hearing loss the same as having a low IQ? Do you say having a lot of hormone deficiencies, which is life-threatening, is as bad as having a low IQ? And it's very difficult. And unless we have a lot of patients that we put through it and try it out, we're not going to know. But what we found was that a quarter of them had no sequelae at all that we could find. A quarter had, minimal problems, no treatment needed. A quarter had moderate problems, and a quarter had severe handicap. I want to stress again, these are children with multisystem LCH. Okay? Not all children with LCH. And we're talking about multisystem LCH only being a quarter to a third of all patients with LCH. So when you look at the whole big picture, not all children with LCH have problems.